There are many types of high blood pressure, which in general is described as a condition that makes your blood's flow within your blood vessels strong enough to cause problems, and one of these types is known as pulmonary hypertension. Pulmonary hypertension specifically targets the lung and the right side of the heart. Some cases of pulmonary hypertension end up worsening into a condition called pulmonary arterial hypertension, PAH. Pulmonary arterial hypertension affects the blood vessels connected to the lungs. The pressure from the high blood pressure damages the blood vessels. The damage lessens the amount of blood flowing through the blood vessel. The body reacts to this by making your heart work harder. If this condition, PAH, persists, then heart complications may occur.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Andrew. Today Michael and I will be covering everything you need to know about pulmonary hypertension, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. Okay Michael, let's start with the symptoms of pulmonary hypertension. What are they like?
Pulmonary hypertension develops over time, and as it develops the symptoms tend to worsen. Look out for the following symptoms, especially if you have high blood pressure. Dizziness. Pain around the chest area. Darker lips, bluish color. Fatigue. Shortness of breath. Fast pulse or palpitations. And swelling.
What are the causes of pulmonary hypertension?
In order to have a better grasp of pulmonary hypertension, it is important to go into the relationship between the heart and the lungs. The main function of the heart-lung relationship is to distribute oxygen to the body. The heart pumps blood into the lungs, and as this blood passes through the lungs, the blood is given oxygen then distributed to the body. When this system is disturbed by any conditions caused by other ailments, such as thickened or damaged artery walls, the movement of the blood is less efficient between the heart and the lungs. This specific condition is called pulmonary hypertension. There are 5 different groups in which pulmonary hypertension is classified under. Each of these groups are different causes. They are: pulmonary arterial hypertension has causes which include family history, illegal drugs and dietary drugs, heart defects and genetic disorders. Left-sided heart disease is caused by specific diseases that target this area. And there is also heart failure. Lung disease causes include sleep apnea, exposure to air pollutants causing inflammation in the lungs, and scarred tissue within the lungs. Chronic blood clots, any blood clotting disorder that could also appear in the lungs. Other causes include cancer, any blood-related disease, metabolic diseases, and inflammatory diseases.
Are there any risk factors we should be aware of?
You are more likely to develop pulmonary hypertension as you get older. The following are the potential risk factors: obesity, high blood pressure, family history, genetic disorder, illegal drugs, dietary drugs, exposure to asbestos, a mineral that can be breathed in and cause lung damage, living in a high altitude area due to less oxygen present in the air, and blood clots.
What are the complications that having pulmonary hypertension may lead to?
Bleeding in the lungs. The abnormal activity of blood between the lungs and the heart may cause blood to spill into the lungs. This complication is life-threatening. Irregular heartbeats. The reaction of the heart to this condition may cause dizziness, loss of consciousness and palpitations. Certain types of this complication is life-threatening. Heart enlargement and failure. The heart attempts to compensate for the lack of blood flowing due to damaged artery walls. This causes the heart to swell in an attempt to produce more blood, however this strains the heart and may eventually lead to heart failure. Pregnancy complications. Blood clots. The likelihood of developing blood clots is increased.
What can be done to prevent pulmonary hypertension?
Healthy lifestyle and constant medical checkups, especially if you have a family history related to heart-lung conditions. This will help your doctor catch on to early symptoms before they worsen.
How is pulmonary hypertension diagnosed?
Pulmonary hypertension is diagnosed through a physical examination conducted by your doctor. Multiple tests will be run through in order to determine the specific cause or causes. Pulmonary hypertension shares symptoms and signs with other heart and lung conditions, and because of this it is required to go to a doctor as soon as any symptoms arise in order to be diagnosed properly. The doctor may consider using the following tests. X-ray. A chest X-ray is used in order to find any enlargements/abnormalities in the lungs or heart. Echocardiogram. This test is used in order to assess the current condition of your heart and the behavior of your heart. Using sound waves, this test can measure your heart's beat, size, health and efficiency. Right heart catheterization. Usually done after an echocardiogram, this test is used to confirm if you have pulmonary hypertension. A thin tube is placed into the body and is sent to the pulmonary arteries/heart. The purpose of this test is to give your doctor an accurate reading of the blood pressure in said areas. Electrocardiogram. This test is used to observe heartbeats. Blood test. Your doctor conducts a blood test in order to check for any signs/symptoms in your blood that may cause you to be susceptible to pulmonary hypertension. Pulmonary function test. This test determines how well your lungs function by measuring the amount of air your lungs can contain, inhale and exhale. Ventilation or perfusion. A tracer is placed into your bloodstream in order to find any signs of blood clots. Computerized tomography. An imaging test that creates a cross-section of certain parts of your body. This test is used to observe the state of your lungs and heart. Open lung biopsy. This test is a type of surgery with its primary objective being to remove a small tissue sample from your lungs. Magnetic resonance imaging. Using magnetic fields and waves, pictures of the body will be taken in order to assess the heart and blood flow in the lungs. Polysomnogram. A test conducted while the patient is sleeping. This test measures vital signs such as heart rate, oxygen levels, brain activity and others. Note, in the scenario that your family has a history of high blood pressure, hypertension or specifically pulmonary hypertension, your doctor might suggest conducting a genetic test to find any genes that are linked to these conditions. Upon being diagnosed, your doctor will classify your condition under 4 different classes. These classes are the following. Class 1. No symptoms. Class 2. Symptoms arise during regular activity. Class 3. Symptoms arise during physical activity. Class 4. Symptoms are felt at all times.
What are the available treatment options for this condition?
As of now, there are no known ways to fully cure pulmonary hypertension. Instead, the symptoms, conditions, diseases that are the cause or is a contributing factor is treated by your doctor. This is also combined with specific medication to slow down or lessen the severity of pulmonary hypertension. Lifestyle changes and constant care is also required to improve health markers and slow down the effects of this condition. Medications. Guanylate cyclase stimulators. A drug that relaxes arteries and lowers blood pressure. May have unwanted side effects and should not be used if pregnant. Sildenafil and tadalafil. Commonly known as Viagra and Cialis, these medicines are primarily used for erectile dysfunction, however they have also been shown to help with the blood flow within the blood vessels of the lungs. Blood vessel dilators. These relax and opens up the blood vessels. Taken through 4-line, orally, inhalation or injection. They may cause unwanted side effects. Digoxin. Helps strengthen your heart and also helps stabilize heartbeat. Diuretics. These help the kidneys expel water from the body and reduces the amount of work your heart needs to do. High-dose calcium channel blockers relaxes the muscles inside the blood vessels. Endothelin receptor antagonists will expand narrowed blood vessels. This drug may improve other symptoms and energy levels, however may also cause liver damage. Constant blood test is required in order to check the liver's condition if taken continuously. Oxygen therapy. Pure oxygen is inhaled to help treat pulmonary hypertension. Helps enrich the blood with oxygen. Warfarin. A blood thinner used to ease the flow of blood within constricted blood vessels. This treatment may cause bleeding. Surgery. Atrial septostomy. A surgeon will cut an opening to relieve pressure from the right side of the heart. This may have complications that can cause pulmonary hypertension. Transplantation. Lung or heart is transplanted into the patient. Includes complications such as rejection or infection. If successful, constant medication is required to avoid rejection of the transplanted organ.
Are there any lifestyle changes or home remedies that may help if you have pulmonary hypertension?
Quit smoking. Smoking affects both the lungs and the heart. Smoking is a known cause for many of the symptoms, diseases and conditions that leads to pulmonary hypertension. Maintain a healthy lifestyle. Proper weight management by eating nutrient-dense food. Stay in touch with your doctors. Any drugs that you may take might cause an unwanted side effect if taken with your pulmonary hypertension medication. Contact your doctor before taking any drugs and ensure that you have regular checkups for monitoring. Get rest. Do aerobic exercises. This has been proven to improve your body's efficiency in general. Avoid birth control pills. Avoid high altitudes. Higher altitudes contain thinner air and less oxygen, which may cause unnecessary strain. Avoid activities that drastically increase/reduces blood pressure. Activities that may drastically increase blood pressure are stress, weightlifting and the like. Activities that may drastically reduce blood pressure are sauna, spas and the like.
Thank you again, Michael, for helping our viewers fully understand pulmonary hypertension.
It's always a pleasure to share with the subscribers of this channel.
To our viewers, remember to share this video with someone who may benefit from the information. Also leave your feedback and topic suggestions in the comments section. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.